Let's talk about the Gattuso Center for Social Medicine. It's a new project in Toronto, Ontario, Canada. Let's talk about it. Welcome to Cranium x Rectum. I am Conrad Hall. Please do subscribe to the channel if you like what you see, if you like what you hear. And what I want to do is talk about a new project in Toronto. It's associated with the Toronto Western General Hospital, and it's called the Gattuso Center for Social Medicine. It's kind of, where do I start? So I think what I want to do is start with explaining who exactly does this center service. And in an article from the Canadian Press by Liam Casey, and all of the articles and more that I reference are below in the description so that you can read them for yourself, you can draw your own conclusions and make your own choices. So in this article, Liam starts by addressing who is served at the Gattuso Center for Social Medicine. He writes, paramedics can drop off residents experiencing homelessness who are intoxicated by alcohol so they can recover and then access services. So for anybody who's my age, I'm 56 at the time of recording, it might put you in mind of the drunk tank. There was a system once upon a time where if the police picked up someone who was intoxicated, who was drunk, they would take them back to the police station and put them in a cell that they referred to as the drunk tank. It was a place where they would put drunks, they could sleep it off, sober up, and generally the next morning be given breakfast and sent on their merry way. That clearly has changed. That sort of innocence is gone by the wayside. But folks who are in that situation still exist. So the Gattuso Center for Social Medicine services specifically homeless people, and homeless people who are intoxicated on alcohol. So if their intoxication is related to drug use, the Gattuso Center is not for them. This is only for people who are drunk. And the idea, actually explained by Dr. Andrew Boozary, and he's referenced below, but his name is spelled B-O-O-Z-A-R-Y, Dr. Andrew Boozary. And he's quoted, Liam quotes him in this article, saying, "This is how we can deliver preferential care and options for people who are shut out of the system, have alcohol intoxication, and do not require urgent or acute medical care." So the only thing wrong with these people is they're drunk. So this is the 21st century version of a drunk tank. And before I go any further, because, this could be a touchy subject. Now, this document, I am not quite ready to share this document publicly, but it's a 4-page document, and it is a psychiatric assessment of me. And this is a psychiatric assessment of me from September of 2014. And the psychiatrist who filled it in, her name is Mary. She is long since retired, so I have no concerns about anyone following up with her. She is now out of the profession. She is retired. So this is a psychiatric assessment. The date on it is September 5th, 2014. The first observation she makes is that I lacked the minimal emotional nurturance required to attain a healthy adaptive development throughout my lifespan. That means I don't play well with others, which, is kind of true. Less true now. I play better with others now, but still not great. And some of the things with which she diagnosed me. Okay, so this is 2014 that this diagnosis happens. Attention deficit hyperactivity disorder. Post-traumatic stress disorder. And the PTSD actually comes from several things in my life, her diagnosis. Alcoholic parents, a father who was extremely abusive, service in the military, even, my last marriage, my second marriage, a wife who was just, wow, a handful, just like I am, except she was a handful in a different way. There was also a car crash, which happened in 1994. Yes, September 23rd, 1994, 1:13 p.m. That's what the accident report says. That car crash resulted in 10.5 hours of surgery. It also resulted in an acquired brain injury. She diagnosed significant depression and lability of mood. There was a piece of my medical history where at one time a physician questioned whether I might be bipolar, which is no longer even acceptable vernacular in the psychiatric community. She says that there is some vegetative dysfunction, and there is a severe affect dysregulation, which means things happen to me and I interpret them differently from how other people interpret them. So much so that once upon a time, again, this vernacular is no longer used, I was sometimes described as having an explosive personality. Basically what it amounts to is I wouldn't talk to anybody about anything that was bothering me. I wouldn't let it out that it was bothering me until finally it just built up and built up and built up, and I just went I exploded all over whoever got in my way that day. She does note it is a tribute to Mr. Hall that in spite of the serious handicaps he suffers from, bad grammar, but we'll let that slide, he suffers from, that he has not had more prolonged hospitalizations or legal difficulties. So that's a little bit out of this 4-page thing. And the reason that I want to make sure you are aware of this is people have this inclination, the psychiatric community has this desire and inclination to propagate the belief that once you have a mental illness, that's it, you are mentally ill for life. Yeah. No. That's untrue. I'll give you an example. Once you are addicted to something, that's it, you're an addict, right? No. One thing that my father did, he woke up one morning, he was a smoker, and he would wake up in the morning and immediately have a cigarette. One morning he woke up, went to light his cigarette, and decided, you know what? I have no desire to do this anymore. And he just quit cold turkey. My mother continued smoking. So my father quit smoking, continued to live in a house with a smoker, a very heavy smoker, never took up smoking again. Both my parents were alcoholics. Both of them acknowledged they could not go a day without a drink. They had to have a drink every day. My father, at one point, was also a drunk. He would drink to excess. Both my parents managed to be alcoholics and keep it in check. They couldn't go a day without a drink, But they got to a point where neither one of them drank to the point of getting drunk anymore. So I can tell you that in general, psychiatrists really have no idea what they're talking about. Mostly because they have never lived it. They without the experience, it's sort of like with my first wife, we had a child. I was in the delivery room when she had the baby. So do I understand what happened? Yes. Do I understand what it is like to give birth? No. Not even close. Okay? I cannot imagine passing a human being out through your body and the pain that is involved in doing that, the effort that is involved in doing that. And I have had times in my life when I have experienced some rather significant pain. So I understand pain, and I understand pain that is point specific, but to give birth, and especially to give birth and then receive that person into your arms who just put you through so much pain and be instantly in love with the baby. Wow. Wow. So, no, I do not understand what it is like to give birth. And that little head throw I will try to avoid because I have a display screen, and I realize that, I don't know, that might be a little vertiginous for folks, so I'll try to restrain my head movements a little bit. But back to the Gattuso Center for Social Medicine. So, the first thing that they come at this situation with, yes, bad grammar. The first thing with which they come at this situation is an attitude that says there is health inequity. Now, I live in Canada. For everyone watching, especially people watching in the United States, healthcare in Canada is not free. It isn't free. There is a cost associated with healthcare. In fact, there are signs when you walk into an emergency room that inform you just arriving at the emergency room is an $800 expense. Okay, that's a thing that we try to make people aware of. One of the differences between Canada and the United States and other countries and the United States is our government says this is what you will charge for an MRI or an X-ray or whatever. And health insurance, so in the province where I live, everyone who has a job, their employer pays a health tax to the insurance program. So we all have health insurance, and by virtue of working and providing value, we are enrolled in the health insurance. We also have insurance programs where, if you have a wife and kids or a husband and kids, you can get health care benefits that cover you and your spouse and your children. The difference being here, it makes no difference whether you have one child or 10, it's the same price. And here, that kind of health coverage, to give you, for example, a semi-private room instead of a ward room with 4 people in it, to give you eyeglasses, to give you dental coverage, all that sort of thing, would run you about $300 a month. Far less expensive than what it is in the United States. Another thing here is when you have insurance coverage and you use it, the insurance company has no option. There's no denial by the insurance company. Because in Canada, if you are covered for something by your insurance and your insurance company says, oh no, we won't pay for that, you file a complaint about that, the government looks at it and says, oh, that's actually covered by the insurance. You said no. So we are going to pull your charter, which means that insurance company is immediately out of business. They don't want that. So they never deny something that is in fact covered. And for people who are, in this case, homeless, that insurance that is paid by everybody else in the workforce is enough to provide healthcare, basic healthcare coverage for someone who is homeless. So the Gattuso Center for Social Medicine says, well, there's an inequity in the health system. Well, if you're going to tell me that a homeless person gets different health care from somebody, for example, working construction. I'm a retired carpenter. So as a carpenter, I had health care benefits. I was single, so my health care benefits were about $175 a month as opposed to $300 a month. And so there were things like vision care, dental care, semi-private room, drugs, all the things that you would kind of expect to find in an employment benefits package, I had. So did I receive different medical care from someone who is homeless? Or someone who is on a disability pension from the government? Yes, because I'm paying for different care. That isn't inequity. That is, you are receiving a different level of service because you are paying for a different level of service. Everyone receives the same basic level of service, and then you just go up from there. That is not inequity. So they're starting with a faulty premise. And the article says, health inequity is driven by both historic and continuing processes. Really? That's a load of caca. Okay, so, because what I'm getting to is, how do we handle this for ourselves? If you are homeless, if you are on disability, if you're just poor, how do you handle it for yourself? Okay, because one of the next things that they say in this article, and this is from the site socialmedicine.ca, which is the site for the Gattuso Center for Social Medicine. One of the things they say is, our approach integrates many ways of knowing. I've published 9 books, and I have no idea what that sentence actually means. Now, I do understand that you can know because you're taught, you can know because you read a thing, you can know through experience, so I get the concept of different ways of knowing. But their next sentence says, we commit to prioritizing lived experience in our work. Okay. So given who it is that they're serving, what this makes me think is they're saying that people who live in poverty, lived experience, are somehow qualified to tell other people how to remedy poverty. No. What I will say is, so someone like Shaquille O'Neal, who now is very wealthy, he came from a not wealthy environment and then became wealthy. Now, he has the ability to talk about how important his parents were to him, how important education is. He can talk about how to be successful by playing basketball. And then now you're reaching the limits of what he can tell you about. Someone else who, for example, Oprah Winfrey, who also came out of a situation of poverty. She can tell you about her experience being poor and working her way up, getting an education, getting into television, working her way up through television, and now being a very successful, very wealthy person. Those are people who certainly did experience poverty, who can now talk about how to move your way out of poverty. Someone who is in poverty has no way of telling you how to remedy poverty because they have yet to figure it out. So they don't know. So ways of knowing includes what? Wishful thinking? You can see how I am less than a fan of this kind of program. One, they've just put a 21st century spin on the drunk tank. Because if you're drug involved, you cannot go there. If you are not homeless, i.e. you have health insurance, you do not go there. You go to the hospital. In fact, if you are not homeless and you are drunk, generally you'll go home to sleep it off. So you would never be in a situation where you're going to be picked up to be taken to this center. Here's what I'm driving at. So I'll go back to a paragraph that I quoted before, and I'll try to get better at this. I realize, I'm kind of all over the place. I'll try to get better at this. So they say that they're trying to deliver preferential care and options for people who are shut out of the system. And yet in the same article, 2 paragraphs later, they say that the program has strict eligibility criteria in place. So they're trying to help people who are shut out of the system, but they have strict eligibility criteria. So they're shutting people out of their system. So people have to be intoxicated with alcohol, no sign of drug use, normal vital signs and blood sugar levels, no recent trauma, and no complicating medical factors. So if you are intoxicated on alcohol and you're a diabetic, or you're intoxicated on alcohol and you have high blood pressure, or cancer, or anything else, no. You have to be otherwise healthy, just drunk, and no sign of drug use, normal vital signs and blood sugar levels, no trauma. So you are just drunk. This is a 21st century drunk tank. But they're trying to make out like they're doing something hugely special and new and eliminating inequities. You're just treating people who are drunk. And at one point in the article they say that what they're doing is they're trying to divert certain patients to better spots. Right, so basically we just don't want drunk people in our ERs, which, in general, I agree with. Drunk people tend to be obnoxious. Some drunks are quiet drunks, some drunks are happy drunks. People who are homeless and get drunk, because they already have a lot going on in their life, tend to get a little obnoxious. And what this ends up being is a way of rewarding people who make bad choices. And that, I think, that's where I want to focus. Okay? Because there's another thing here, there's another organization that helps them. It's called the Neighborhood Group. And there's a person quoted in the article, you can read it, her name is Narissa McLean. And at one point she's quoted saying, basically, my job is to help manage somebody's life. And I have to say, wow, that describes a lot of parents today. Speaking as a parent, your job as a parent is to curate the obstacles your children encounter. And how you do it when they are very young is different from how you do it when they become young adults around 12 years of age. When they're very young, absolutely there are things that you just say, no, we are not going to allow you to run the circular saw. No, we are not going to allow you to drive the car. Okay? No, you may not use the sewing machine. Okay? There are things, don't touch the stove. There are things that we prevent children from doing. But there are parents who endeavor to remove all obstacles from their children's life. Wrong. That is absolutely 100% wrong. Human beings are goal-seeking creatures. We require obstacles. We require challenges. Without them, we basically become dicks. And we get extremely frustrated because there's no challenge to overcome. The most extreme example of this is when a child is around 2 years of age and starting to develop language skills. Parents who, because it's easier for them, parents who work with the child, and the parent says, oh, you want a snack? The parent will open the cupboard and go, do you want a cookie? Do you want this? Do you want a flaky? Do you want... And go until the child goes, and then they'll give the child that snack. Instead of what a good parent does, and if you dislike that delineation, calling you a bad parent, then maybe don't be one. There's a thought. There's a Cranium X Rectum moment. Stop being a bad parent. A good parent says, okay, this is a cookie. Say cookie. So you get the child to just say cookie. Eventually you teach the child, may I have a cookie, please? You have to teach a child how to speak. When you fail to teach a child how to speak, how to articulate themselves, what you do is you end up locking them into their own head. They have no ability to express themselves. What is the general term for this? Autism. Autism isn't some virus. It isn't some bacteria. It isn't some randomly occurring thing. Autism is what results when you have bad parents who never put in the effort to teach their children how to articulate themselves. Because once that opportunity has passed, once that time in life when they are supposed to have learned language skills passes, it's gone. And to teach the child now how to articulate is magnificently more difficult, because now they're locked inside. So you have to undo the damage that was done and then start all over again. Only nobody's doing that. Now we're just labeling kids, oh, well, they're autistic and they'll just have to live that way for the rest of their life. Nobody's actually trying to solve it. Actually, I should avoid saying that, because there are people who are working with kids who are autistic, helping them learn how to communicate. But the point here is, the Gattuso Center for whatever is doing the exact same thing with adults. Instead of saying, listen, you are an adult, that means you have 100% responsibility for the choices you make. Now, you have arrived at a place that is a bad place. You are homeless, you are on disability, you know, whatever it is. You are in a bad place. You have lost your job, you are poor, you lost your house, you're filing for bankruptcy. Okay. First thing, understand, your past is just a story. Did it happen? Yes, it did. Is there anything you can do to change it? No. There is no way to change a thing that is done. Who you are today, the choices you make today, are what determine who you will be tomorrow. They determine who you will be this afternoon, this evening. The choices you make now can change what your future will be. Now, you can just stay where you are, whine, moan, and complain, and continue to get drunk, or you can make choices to begin to improve your life. That's what needs to happen here. But this center does not do that. Their center is, one, they say we meet them where they are at and are non-judgmental. Okay, I like that idea, but they're also non-judgmental in that they will allow a person to continue living that way. That's wrong. You need to show people how to live a life that is filled with healthy relationships, that is powered by personal responsibility. I am responsible for the choices I make. And they are supported by community accountability. And all of those tools exist. They just, right now, are not using them. Instead, they take the attitude that, well, basically, my job is to help manage somebody's life. No, that is not your job. That is no one's job. Your job actually is, or should be, showing someone how to manage their life. Showing them how to take 100% responsibility for themselves and the choices they make. Supporting them in the process of learning how to do that. Rather than treating them like infants and making all the choices for them, without ever telling them, okay, you need to make some changes in your life if you want your life to get better. All right. I have no idea if this has been useful to you. I hope it has. I am going to post it the way it is, and I would really appreciate, appreciate if the trolls could just farfignog it off. Doubt that will happen. But if you could think about what I've said, how I've presented it, and if you have any thoughts about how I can do this better. Right now it's just me, clearly sitting in my recliner in front of my living room window, shooting videos. So, I need to get views, because YouTube pays based on the number of times a video is viewed. I will put something together where if you think what I'm doing is useful and helpful, if you would like to support it, fantastic. But most importantly, the most important thing you can do to support this right now is please give me a comment below. What are things that I can focus on or not focus on? Is there anything that you would like to see clearer? Any questions that you have? How can I improve? And I know this is a big ask. If you could keep coming back and watching other videos and doing the same thing, anything you see where you think that I could make an improvement, please let me know. I would love to hear it. Seriously, I would love to hear it. Again, however, the trolls could live without you, okay? Thank you very much. Please do like the video. If you would subscribe, that would be fantastic. And I hope that you come back and watch some more videos.